My name is Mark, and I'm a residential rehab worker. Part of my job is I work in a workshop and I teach intellectually challenged adults woodworking and refinishing. I've worked at my facility now for 27 years. And it's complete physical care on some of the units and also supportive care for individuals with intellectual disabilities and behavioral issues. The best part of my job is always providing care and having great relationships with the population I serve, the clients. You form bonds, you become a care coordinator for an individual, and you're like family. So putting a smile on someone's face, sharing a joke, having a good day, that's the best part of my day. And although you're expected to come to work and do the job for the entire period, there is always the administrative side of documenting, reading, knowing policy, that there's just never time to do. Overtime, back-to-back overtime is happening more in the last few years than it's ever happened. And the employees, like myself, that are long-term employees, are coming to work hurt, injured, tired, but we're doing it for the care of the residents, of our clients. We sometimes have one staff in a home with 3 to 4 clients, or we have units where, especially on a night shift, you only have 2 staff and you could have 25 clients. Yes, things are quieter on those shifts, but it's a behavioral facility. There's always things that happen. I always think there could be more people, better training, and just increase your health and safety to reduce risk to your residents and your staff. I think the solution to that problem is allotting time for individuals to do that paperwork, providing an extra staff who could cover the floor while an individual could do that. Possibly by having a float staff who's throughout the building during the day. If you had a consistent piece of legislation that set out the guidelines and parameters and you had to follow it, then there would be real recourse if employers didn't meet that. There was something that could be done, an enforcement side, tied into health and safety, tied into work legislation that would certainly help that. We have an aging population where people are living longer, which is fantastic, but many people are living longer with complex health issues. We have a shortage of long-term care beds. We also have a shortage of people to work, and we're beyond a nursing shortage, we're in a nursing crisis in the Maritime provinces, with 3-year wait times to get into the nursing program and no more spots. We need more healthcare workers. People aren't paid enough. Benefits, allowing not just full-time and part-time people access to the medical benefit packages would be huge. You could recruit and retain individuals. And actually allowing people to use their expertise and knowledge and have their voice be heard to develop programs and care for individuals would be a great deal of respect. I believe families could help nursing homes get more funding by lobbying MLAs and government to explain the need, and that the care of their loved one is first and foremost the most important. Having less staff to care for more people is unacceptable. The risk is unacceptable.